There is a saying that when the sun is too hot, you look to the moon for comfort. Sometimes the moon might not necessarily be the best place to seek comfort, but comparing it to the sun, at that very moment, it is the best. The influence of African community of health workers, most especially doctors and nurses to European, American, and Asian countries for greener pastures should be a thing of major concern to the government, most especially my dear country, Nigeria. Now vex, charity begins at home, so let me talk about my own first. If we look at some statistical reports on doctors and nurses leaving Nigeria, according to the Nursing and Midwifery Council of the United Kingdom, about 15,000 Nigerian trained nurses were accepted and gained license to join the NMC UK and practice as nurses between 2017 to 2021. The data shows that Nigeria is the third highest country with foreign trained nurses joining the NMC UK register. By June 2022, about 5,000 Nigerian nurses joined the register. Now, imagine how many joined by the end of 2022. And these are just the few nurses they could recruit, because there are millions of Nigerian nurses who are qualified and are sending applications to different NHS trusts every day, even as I speak. The report also has it that 2,493 doctors were also recruited between 2021 to June 2022. Everybody wants Jappa. What a mess. In the nearest future, we might not have health professionals in Nigeria if the government does nothing to stabilize the healthcare sector. May God forbid bad thing. This has led to a decrease in the number of nurse-to-patient ratio in most hospitals. Now, in some hospitals, the majority of those wearing whites and being called nurses are actually quacks. You will wonder why the high rate of mortality is increasing in most of these hospitals. Are we to blame these health workers for jackpotting? In my opinion, no. We can't blame them at all. When the government has refused to look into the welfare of health professionals, of course, they will look elsewhere where their skill is appreciated. Imagine after finishing nursing school and you are being paid 45,000 naira or less for your nursing services. God abeg you, is it for gari, eba, or beans? Is it for dudu or what? As a registered nurse trained in Nigeria, I know how we were being ridiculed when we applied to some of these hospitals. Let me not even talk too much, because my eyes see shaggy before I finally saw the light. Information, they say, is power. Instead of this government taking action and making sure the health sector is doing very well by providing standard medical equipment and paying the workers well to balance the harsh economic situation, they rather prefer to travel abroad for medical checkups, ignoring the fact that not all can afford to travel. It is now the poor masses that will be affected as they can't afford to travel abroad for medical purposes. You will hear he died of hyperglycemic crisis and other minor medical conditions. These are merely caused by an inadequate supply of medical equipment, medical negligence, and poor practice due to poor staffing. Imagine one nurse to more than 30 patients because of staff shortage. That nurse will definitely get exhausted and the brain getting fatigued. And mistakes are bound to happen at this stage. You too wonder why the public will say things like, the nurse do the verse. Tell me why you no go verse. He or she is not happy, of course. Or a doctor to clerk and manage hundreds of patients. Come on, the doctor is also human and not a machine. Even machines do break down. There are many reasons why these doctors and nurses live in massive figures every year, such as poor remuneration, insecurity, inadequate facilities and working equipment, and poor working environment. It was said by the president of Nigeria Medical Association that the last time salary for doctors was reviewed was in 2009. That's like 13 years ago. Even with the inflation and harsh economic crisis, wetin dey happen sef? Even some consultants will prefer to go abroad and start at lower level at this stage. He also said the only increment they got was a 5,000 naira addition, even when he had written severally to the government to review the salary scale of doctors, yet no reply from the government. So tell me why the doctors won't Jappa in droves. I have a doctor friend who said that when he migrated to Canada, he told me he received the first salary and he shed tears on receiving his first salary. As a nurse, any less than 100,000 naira in Nigeria, when you migrate to these countries and you are paid your first salary and you decide to convert to Nigerian naira, there is this, now maybe this kind of feeling that comes in. The pay and working conditions for nurses in these countries will at least give the nurse a reason to put in his or her best and practice effectively, even though tax and bills sometimes take half of the pay. Someone will be wondering why the bad treatment from our own government. No be say abroad na heaven, no, but it is better than Nigeria in many ways, actually. We just have to get it right and get the right people into government. I made a video on this. You can check it out on this channel. These countries need nurses and doctors every day, and they know the importance of human resources. So since the Nigerian government is not valuing them, let them go to where they are most valued and appreciated. I am Michael Oduburu. I believe in a working Nigeria. I am very passionate about this.